And now it's time for a real powerhouse panel. Lisa Sherman is the president and CEO of the Ad Council. They recently launched their own COVID-19 vaccine education initiative. She's got a great Twitter feed. I'm already following it and addicted to it, so thank you for that. Mayra Alvarez is president of the Children's Partnership, a nonprofit advocacy organization working to advance child health equity. Mayra is also a newly named member of the Biden-Harris COVID-19 Health Equity Task Force. That's a mouthful. Dr. Eliseo Pérez-Stable is the director of the National Institute on Minority Health and Health Disparities at NIH, and Dr. Giselle Corbie-Smith is Distinguished Professor and Director of the University of North Carolina's Center for Health Equity Research. Folks, if we can't solve this problem today amongst the four of you, then I don't know what's going to go on, because each one of you sits in a corner. We have the Ad Council, we have medical doctors, we have experts on health equity across generations and across other divides in society. So I really appreciate all of you joining us. Dr. Pérez-Stable, let me start with you. I've interviewed many of your colleagues, doctors, others at NIH, and during the previous administration, and I kept asking them about what's the communications plan. Are you going to reach into Native American communities, Black communities, Hispanic communities, by the way, all of which are not the same? I mean, you kind of go around and you kind of look at the diversity of the fabric of this country, and the kind of it requires some support. And everybody said, "Don't worry, we've got it taken care of. We got a communications plan." So I guess my question to you, because you've been out there saying we not need only you had a great line, that messages should not just demonstrate cultural awareness, but cultural humility. And I'd love to kind of get your sense on whether we got the rollout and communications right, whether it's still in progress and we need to do more. Let's start with you, and then we'll move around. You're on mute, Doctor.
Hey, I'm sorry. I would say that the communications plan from the very beginning was there, but it is a work in progress all the time, because we learn as we do this. And you're absolutely right. The community is very diverse. We have to adapt and tailor the messages depending on the population, the geography, the age, where people are coming from. And so I think this is critical. The most important point, though, is that we need to develop trust and build trust in the science, in the evidence that we have as scientists and as a public health infrastructure. And the messengers delivering that message need to also be trusted by the community. It doesn't have to be Dr. Fauci all the time, because he just can't do it. It doesn't have to be the faith-based organizations only. It doesn't have to be a celebrity. It actually, a very effective messenger is your local doctor, nurse, or other health worker who can relate to the community they work with. So we're working on it. I think all of us are pulling in the same direction, and I'm very pleased with the progress we've made since beginning of last summer.
Well, I'm glad to hear that. I mean, Dr. Corbie-Smith, let me ask you. The other day, I sat down in a heartbreaking Zoom call with people talking about some of the inequities in America's healthcare system. Talking about maternal mortality and the racial divides there, talking about chronic diseases and the racial divides there. And I just walked away and I just said, holy crap, this is just something that is outrageous in many ways. And now when you throw a pandemic on it, we've seen how the pandemic has hit communities differently, has hit the Black community. Right now, I'm going to be talking to Mayor Garcetti in a moment from Los Angeles. The Hispanic community is now dying at the highest rate among different groups in Los Angeles. But I guess, there's one way to kind of look at the history of this, which I'd love to get a snapshot from you on. There's another way to sort of say, can this be fixed? I mean, in the pandemic, can we rewire the social contract in a way that's fairer and better than it is today?
Well, I appreciate that comment. And in terms of the prior panelists, I think I would endorse the idea that you can't let a good crisis go to waste. And so we have seen the fault lines between our public health system and our medical and our healthcare system in the setting of this pandemic early on, the important guidance that we were given around staying at home and what this has meant for communities of color, particularly Black and Brown communities, what it's meant in terms of the economic impact. And we're only beginning to understand the health impact in the first 6 months of the pandemic, based on data that we have, we know that life expectancy has decreased for Black and Hispanic or Latinx populations more than the white population. It's gone down overall, which to me is in and of itself remarkable. But Black populations has had almost a 3-year decline in life expectancy. Latino populations or Hispanic populations, almost a 2-year decline, and whites almost a 1-year decline in life expectancy. And that's in the first 6 months of the pandemic. This is a crisis that really has revealed for many that aren't typically in this space, like our panelists are, that health inequalities are long enduring and entrenched. And if we're not careful in this moment in time to really capture and take advantage of the way that we need to rework our healthcare system and our public health system, will be back in the same place in a couple of years.
Before I jump to Mayra and get this, and then I'm going to ask Lisa just to figure out what the course is to reach everybody. But I want to ask Dr. Corbie-Smith, when you think about what ought to be some of the essential pieces of communications plans, what to reach these communities, to get them where they are, what are some of the things that are high on your list?
Well, as Eliseo pointed out, this is about building trust, and I would even go so far as demonstrating the trustworthiness of our healthcare and our public health system and our scientific and medical community. The onus needs to be placed on us that are in that space to demonstrate our trustworthiness. We also, there's been a tremendous amount of work that has taken place over this last year that have pulled together communities that have tried to bridge that divide between public health and our healthcare system. And we need to look at those pieces and to see what we can do to make sure that they're in place after this pandemic. How can we build and extend the workforce that has grown up around this pandemic, our community health workers that are typically straddling all of these elements of our communities, of our healthcare system and public health, a vital force that has been fully recognized in the midst of this pandemic. What do we understand about effective communication, whether it's in the setting of misinformation or accurate information, depending on your flavor and what you see as true or not true? But we do know about what gets to people and what people pick up, right? And so how do we use that information to ensure that everyone has the information they need to make an informed choice, whether it's about COVID-19, vaccines, or the treatment of hypertension in the future?
Thank you for that. Mayra, I think I have been on every phone call with so-called senior administration officials of the Biden-Harris administration since they've come in, that they, talk to media. I make time to make sure that I'm on all of them. And I do get a sense of the urgency. They always talk about equity. They talk about both how we reach in different communities. But, I know that you span a couple of roles. You're both an advisor, but you also worry about children. You're, children of Mexican immigrants who've come in this country. So you've got a lot of perspective in this space. And I guess I would ask you, in a polite way, what are the blind spots in conversations of this that you think we should be aware of and that we need to fix in being serious about plugging some of these holes as we build trust and communicate around COVID vaccine?
Sure, definitely. And first, in a polite way, it's Mayra. Just want to clarify.
I'm sorry, Mayra.
Mayra.
Yeah, thank you.
No problem. No problem. So I think first and foremost, I want to emphasize that those of the communities that are hardest hit are also the same communities that are on the front line keeping our economy open. So it's folks that are working the tough jobs, taking care of those of us that have the privilege to work from home. And so many times they don't have the luxury of time. And for many of our sites that are based in the community, bringing care to where they are, it's incredibly important. But we also need to be flexible and ensuring that there is a huge gap when we know many of those families are working. So an example that we applaud is both East LA and Oakland here in California, working with the administration, opened up vaccination sites. That's tremendous. Again, bringing care to the community. But here in San Diego County, we were able to open up vaccination sites and have walk-up clinics, right? Walk-up sites so that families don't have to wait for a certain window of time, but go on their own availability. accountability. In addition, building on what Dr. Pérez-Stable said and Dr. Corbie-Smith is really thinking through who are those trusted people. We know community health centers, promotoras, community health workers, they have that trust and they can actually be proactive in reaching out to populations, not waiting for people to come to them, but being proactive and reaching out by phone, seeking them to come in and get the vaccination. I think that specific intentional efforts to reach our communities is necessary and something that we want to ensure we do. And to the point of Dr. Corbie-Smith, making sure that we're not placing the responsibility only on communities of color, but recognizing that there are historical structural barriers to care for many communities of color. They have less access to healthcare, less access to transportation, less access to safe communities. And it is a result of those inequities that COVID is hitting these populations so hard. So we have to have a recognition that it's not only the responsibility of communities of color to actively engage in this process, but for our systems to better serve them as well.
Mayra, I really appreciate that perspective, and I'm going to jump to Lisa in a second, but I want to ask you one more second, Mayra, and I apologize about mispronouncing your name. But I this need to be careful here. But I was in a drugstore in Maryland the other day that was dispensing the vaccine, and happened to hear a conversation between an elderly black gentleman, probably 70s or 80s, and trying to tell the person working there that they had been trying over and over and over again every day for many, many weeks to get an appointment. And I could tell that they were not connecting. So I told the gentleman that he could go online, and usually around 7:30 in the morning, there were a lot of appointments. He said, look, I don't have a computer. I'm calling the phone number. And he was talking about his phone, and he was reaching out. And I wanted to say to this young intern, take this guy. This guy's here and wanted to show up, has been trying to do it. Is there as we're all pretending to be sensitive, as we're trying to look at reaching people where they are at scale, is there an insensitivity that we need to figure out in this? Because I was fairly upset when I saw this happen. But I realize it's a boutique, maybe hopefully anomalous moment, but it made me very frustrated when I saw that happen.
I think there is a misunderstanding of what many of us have access to and take for granted, right? Whether it's broadband access or being able to wait on the phone and expect to come up with an appointment. Not all of our families have, like I said earlier, the luxury of time. So knowing that is the reality, what can we do to address that barrier? Again, having these walk-up clinic sites, having folks that know these patients, that have a relationship with the community clinic, reach out themselves, recognizing the power of our community leaders and promotoras and community health workers that have that trust. Those are intentional efforts that will help address this just lack of equity when it comes to our everyday lives. And if we recognize that, if we start there, if we start with our most marginalized communities and the limitations that they may be facing, we can make sure to have more equitable distribution of the vaccine and really get the virus under control.
Well, thank you. Well, Lisa Sherman, now as we kind of look, we've heard from our friends at NIH, our friends looking at diversity, our friends looking at other divides. I know that the Ad Council has been working on education initiatives, working with the Latinx communities, working with the Black community on with a campaign called "It's Up to You." I'd be interested in this is the wrong way to frame it. What are the tricks of the trade for succeeding in communications that our colleagues here and those watching online ought to be aware of?
Well, thanks for the question. Obviously, this is the biggest public health issue of our lifetime. So we just launched the most significant public education effort in our history, along with our partners at the COVID Collaborative. And we have this unprecedented challenge, right? We're trying to get probably 250 million people to take a specific action. And the way we do everything is we ground everything we do in facts and research. And if you look at the data, and you remove the folks that have already gotten vaccinated, those that say they're going to get one once it's their turn, and those at the other end of the spectrum that say they're probably never going to get one, they're about 40% of the people in this country who are really, we see them as the opportunity. They're taking a wait and see attitude. They're still undecided. They're looking for real world evidence and assessing the risk benefit analysis for themselves. And I think that just underscores the need to get them educated on their journey. And that's really the approach we're taking. And as we begin to understand the hesitant mindset, we know that trust is at the core. We've heard that in this panel with my colleagues here, as well as the previous panel. And it's complicated and it's very nuanced. And so we understand that this is not a one-size-fits-all proposition, that we really need to have a common messaging platform, but we are looking at multiple distinct campaigns to reach specific audiences. And we've got specific strategies in place to reach the Black and Hispanic communities, as well as the white, conservative, rural populations as well, where we also see hesitancy. And the common thread, it's like a three-pronged approach we're taking. Number one, we have strategic media that can reach those audiences. Number two, so that allows us to go broad, but then we're going deep. And we know, and we've heard this over and over, we have to be in communities with people at the grassroots level, partnering with community-based organizations, faith-based organizations, who are those trusted messengers. So from our perspective, we're working with everyone from the NBA and MLB to NASCAR and WWE to very Big Ten. We're looking at working with influential faith leaders, really prominent folks in the Black and Hispanic community. And we're also engaging with conservative evangelical faith leaders, because that's how broadly we have to approach this. And so that's the tack that we're taking.
I want to ask I want to get a question in from our audience for you, and we're a little short on time, which I apologize because I love this conversation. But Dr. Pérez-Stable and Dr. Corbie-Smith, one of the, and all of you really, one of the things that sort of haunts me about this moment is whether or not we actually do things right. We do figure out a way to reach into communities. We do move the needle in ways we hadn't before. That it all disappears and that, something else happens down the road. So, Dr. Perez, I would ask you, when it comes to things like clinical trials and reaching communities that we've always heard, in the research part of this, we have replicated essentially, some of the same divides and divisions that we're talking about today. And so I would just like to ask all of you real quickly, do you think that this experience and that the lessons we're learning about reaching is going to become institutionalized? Are there things we need to do to make sure that it's institutionalized and built so that we are, connecting in serious ways down the road if we do get this right? I mean, I live in Washington, D.C., and, it's not, institutional memory here is not great. So, Dr. Pérez-Stable?
I live in Washington, D.C. as well.
Well, institutional memory is good at NIH, but nowhere else.
Yeah, the message and the experience we're witnessing now didn't come out of thin air. Yeah. This is the product of work that scientists and public health advocates and community organizers have been doing for the last 30, 40 years. That's been part of my entire career, and Dr. Corbie-Smith's as well as many others. And so I think that this opportunity, this crisis, created an opportunity for us to implement these. And to Dr. Collins's credit, he saw that opportunity and he invested significant resources that Congress had allocated to NIH to do testing. And so we were able to set up this community-engaged network to do more testing. After that, we set up this community-engaged alliance against COVID to deliver the message and to get the trusted messengers out there and to partner with organizations like the Ad Council and all of these community organizations. So my vision on this as an institute director is that this is not the end once the COVID pandemic is managed or controlled, but we are actually moving in a new direction to set up an infrastructure that will be able to address our chronic pandemics, from diabetes to structural racism and discrimination to substance use, all the things that we've been dealing with and addressing for the last couple of decades. So that's my short answer.
I really appreciate you giving that context, because I think a lot of us don't know that. It's really kind of heartening to hear that. Dr. Corbie-Smith?
Yeah, so I would just pick up where Eliseo just ended, which is, I think, for us to take advantage of this moment to ensure that everyone has an opportunity to live a healthy life. We need to be clear-eyed in what got us here, that this is not just a virus. The virus revealed policies, practices, and norms that have led to inequalities in health and healthcare for as long as we've been collecting those data. This is not a new problem. This is an issue that was revealed by the virus. And similarly, the vaccine deliberation that we're seeing in communities, and I prefer that term over hesitancy, is exactly what Lisa has described, is that people are watching and waiting. In Black and Brown communities, BIPOC communities, we're waiting to see, is this system really going to right itself? After years and decades and centuries of demonstrating that the lives of Black and Brown people were not valued in the same way, what is going to be different this time? And that underlines so much of the deliberation that I see in my patients. For that some people, it's going to be a slow yes to get to vaccines. They're waiting and watching, and so grateful for Lisa's work through the ad campaign, the ad council, to be able to offer accurate information so people can make an informed choice.
Great. I also appreciate that context. Mayra, Lisa, quick thoughts? Mayra?
Well, I'll just say, go ahead, Mayra. I'm sorry.
No, go ahead, please.
No, our focus at the Ad Council is to take on the big issues facing the country, and we focus on a lot of health-related issues. And I could not agree more that the systemic health inequities rear their heads across every one of those topics. And the infrastructure that we're putting in place for what I'm calling the air game, the broad reach of the Ad Council, and now coupled with what I like to call the ground game, where we're reaching into communities through partnerships and coalitions, has to be part of how we're going to attack these issues going forward, for sure.
Great, thank you. Before we take a question, Mayra?
And the only thing I will add is that the crisis that we're facing right now, it's really a convergence of crisis. It's the pandemic. It's a struggling economy for families. It's ongoing racial injustice. And when we saw protests, for example, across the summer because of the murder of Black men and women, it was calls for justice. And it's those same communities that are looking for calls for justice when it comes to their health and their well-being. And the pandemic has laid bare the inequities, and there's no turning back from that. And I think all of us remain hopeful that together we can address structural racism, we can address the barriers to care that so many of our communities have faced for centuries, and we can make a difference and provide health and well-being for many more Americans.
Well, thank you for that. We have a question from Wilson, Washington. Dr. Wilson, Washington.
Hi, my name is Dr. Wilson, Washington. I'm the Director of Health and Human Services for the City of Atlantic City, New Jersey. And I have a question. My question is, what is the number one reason why people in community of color may experience vaccine hesitancy?
Good question. Dr. Pérez-Stable?
I think there's a lot of misinformation that has been disseminated about this is a conspiracy. You're going to get the virus. They're injecting a chip. It comes from multiple sources. And I think that the public health community and scientists were a little slow in reacting to addressing this misinformation. And we kind of thought, well, the data will shine through. Well, guess what? We can't rely on that. We have to be proactive in promoting the trusted messages. The problem is exacerbated in the African-American community because of the historical inequities. And again, reiterating what I think Mayra said earlier, we have to acknowledge history and move forward. We cannot ignore that and say, oh, everything's okay now. No, that's not the message. We have to acknowledge the past and move forward.
Just quickly, let's get everyone. Dr. Corbie-Smith, Mayra, Lisa?
Yeah, I wish I could give you one reason. I think Eliseo very eloquently points out the need to acknowledge history. And while there is a clear history that's already been acknowledged for Black communities, Indigenous communities, Latino communities, Asian communities in this country, and Asian communities now are experiencing disproportionately racism and discrimination because of some of the political rhetoric around this pandemic. I think that history, plus the way the everyday experiences of people in and with the healthcare system are part of the reasons that undergird this lack of willing to entrust their lives, frankly, to a healthcare system that's demonstrated that it hasn't really valued their life.
Thank you, Lisa
Sherman. I would
Sherman.
just add that based on our research, I would just underscore the distrust in political and economic motives of the government and corporations. And then just some basic things like people just have concerns about the safety and side effects, the speed of the clinical development process. And then, of course, we know that there are these established and novel conspiracy theories that live out in the world. So it's really a combination of all of those things.
Mayra? And I would just add that it isn't one quick answer that we can provide, right? It has to be multi-pronged solution. And I think falling back to believing that it is one quick fix is going to lead us nowhere. And recognizing that we have to have multiple efforts to address this, recognizing historical discrimination, recognizing the real structural barriers that continue to exist in these communities, and working together to rectify that.
I would love to have this conversation, like every 3 months and just, take the temperature of where things are. I learned a lot from all of you. I learned, one, that there's been more going on in the messaging and thought, than I had been aware of. But I'm also aware that you can go to Greater Baltimore and you can go across a zip code line and there's 20 years difference in life expectancy. And so I think this curve between, what we need to do by way of messaging, for those communities, but at the same time, making other people realize, in fact, there are these disparities that have to be fixed. I really, really appreciate the candor and honesty that all of you have brought to this. Lisa Sherman, President and CEO of the Ad Council. Mayra Alvarez, President of the Children's Partnership and a member of the Biden-Harris COVID-19 Health Equity Task Force. Eliseo Pérez-Stable, Director of the National Institute on Minority Health and Health Disparities at the National Institutes of Health, which I love. NIH interviewed Francis Collins, many other folks that are just doing great work. And Giselle Corbie-Smith, Director of the University of North Carolina Center for Health Equity Research, and Kenan, Distinguished Professor of Social Medicine at UNC. Thank you all for joining me today and for sharing your important work and thinking.
Thank you. It was great.
Yeah.
Thank you.
Yeah, and we'll come back in 3 months.
Excellent.